Hello, hi, this is Lorenzo, and I'm going to be doing a lecture on the specifics of the cardiovascular circulation. So before I say anything, or before I start, let me say that when we refer to the cardiovascular system, we're referring to the organ. Specifically, it's called the heart. Okay, the heart is a very interesting organ because it is autonomous. It has an autonomic ability. It is able to be regulated by the nervous system, particularly the CNS and the PNS, which stands for the central nervous system, particularly the autonomic nervous system. However, the heart has the ability to control itself. It is autonomous. Actually, one of the characteristics of the heart is that it is autonomous. Okay, so one of the characteristics of the heart is that it is autonomous. It is extremely excitable. Okay, has excitability. So for the basis of this class, for this lecture, I want to understand that the heart we're dealing with is controlled by the conduction system, the conductive system of the cardiovascular system. And the conductive system is composed of the SA node. We'll call it SAN for SA node or sinoatrial node. It will then conduct a message down the conductive pathway to form what is called the AV node. The AV node stands for atrioventricular node, and this area here is also what's called the bundle of His. It is known in medicine as the His-Purkinje system, but in this case we'll just call it the bundle of His for basic units. So here it is then sent down the pathway into the right and left bundle branch. So here we're going to call it the right bundle branch, RBB. Here is going to be called the left bundle branch, LBB. Okay. Now notice that this is the right. It is in my right. However, in the patient, it is in my left, but it is actually the patient's right. So we're always looking at in the anatomical position, always regarding the patient. Okay. So it is then going to transmit this message down the Purkinje fibers, and we have right Purkinje fiber, and we have left Purkinje fiber. Apologize for my handwriting. Medics don't really have good handwriting. So basically here in this very quick analytical sketch, the SA node sends and transmits electrical impulse at a rate of 60 to 100 beats per minute down to the AV node, the AV junction. This is called the AV junction. The AV junction. Okay, and this AV junction has a rate of around 40 to 60 beats per minute. It will transmit this down to the right and left bundle branches, and both of these right and left bundle branches have a respective rate of around 20 to 40 beats per minute. Okay, basic. So this here is called the, particularly this is called the conduction, the cardiac conduction system. Okay, so now back to the topic. Well, the topic is the cardiovascular circulation. So the heart is composed of 4 chambers. Okay, so we're going to draw those 4 chambers right now. Okay, so this one here, this is called the right atrium. This one down here is called the right ventricle. This one here is called the left atrium, and this one here is going to be called the left ventricle. The heart is composed of these 4 chambers. Okay, there's two atrial chambers, 2 ventricular chambers. Note that the atrial chambers are basically collecting, right? Their purpose is for collecting blood, and for the ventricular chambers is for pumping blood. So the right atrium is going to be receiving deoxygenated blood via the superior vena cava, and the right atrium also receives it from the inferior vena cava. This deoxygenated blood, right, deoxygenated blood will come to the right atrium, fill to the brim, right? Once the pressure builds, it will open the valve called the tricuspid valve, right? This will open, blood will come down to the right ventricle, and then it will fill to the brim. It will open, and then it will fill to the brim, put pressure on the right ventricle, and it will open another valve. This valve is called the pulmonic valve, PV. The pulmonic valve will open, causing the oxygenated blood to flow down to the lungs, okay? Now we have right and left pulmonary arteries. So the deoxygenated blood will leave the right ventricle via the right and left pulmonary artery. It will then come to the lungs, and in the lungs, the deoxygenated blood will become oxygenated, right, via the infusion of oxygen via the bronchus. So what this happens here is we have oxygenation occurs. Okay, so the blood will then leave the lungs and enter back to the left side of the heart via the pulmonary vein, okay, PV, pulmonary vein. It will then come to the left atrium, go back to the left atrium. It's then going to fill to the brim. Pressure builds. When that pressure builds, it's going to open another valve. This valve is called the mitral valve. They call it a mitral valve because it literally looks like a bishop's mitre, right? It looks like if you actually cut this in half and you look inside the mitral valve, it looks like a bishop's mitre, yeah, like that. It's like a Catholic bishop's mitre. So for all the Catholics out there, yeah. Anyway, so the deoxygenated blood will come down the left atrium because of the opening of the mitral valve, come to the left ventricle. From the left ventricle, fill to the brim, and from when the pressure builds, it will open another valve. This valve is called the aortic valve, right? So when this is called the aortic valve. So from the aortic valve, the deoxygenated blood leaves the aorta. From the aorta, it will then disseminate into smaller arteries and send oxygenated blood and nutrients to the rest of the body. So this is called the systemic circulation. So remember, the oxygenated blood leaving the left ventricle, this is called systemic circulation. The deoxygenated blood coming back to the right atrium, down the right ventricle, down to the lungs, and back to the left atrium, this entire system is called pulmonary circulation. Okay, so basically here we have in a nutshell concepts of the cardiovascular circulation. So this is what is basically the right side of your heart is dealing with deoxygenated blood. Okay, the left side of the blood is dealing with oxygenated blood. Okay, so all this is deoxygenated, all this is oxygenated. Remember, right side of the heart is deoxygenated blood, left side of the heart is oxygenated blood. Blood coming down from the right atrium down to the right ventricle, down to the lungs to be oxygenated, and back to the left atrium. That is pulmonary circulation. Blood that is already oxygenated, leaving the left ventricle through the aorta and to the rest of the body, right? That is called systemic circulation. So this is going back to the rest of the body. So it makes sense that the pressure in the right side of the heart is much lower than the pressure in the left side of the heart. Why? Makes sense, right? Because the right side of the heart only sends it to the lungs to be oxygenated, whereas the left side of the heart, particularly the left ventricle, requires much greater pressure in order to pump and jettison the oxygenated blood to the rest of the entire body. So that, my friends, is in a nutshell the cardiovascular system, cardiovascular circulation, I mean. Enjoy.